Hi, I'm Randall Milheiser. I'm with the RUS Telecom Division, and I'm here to present the 2019 Traditional Distance Learning and Telemedicine webinar. Distance Learning and Telemedicine Grant Program. Program purpose. The program provides or improves distance learning and/or telemedicine services in rural America by funding equipment that allows rural residents to access distance learning or telemedicine services from hub sites located in larger urban or suburban areas. And this is to overcome the effects of remoteness and low population density. Distance learning means the synchronous delivery of curriculum via telecommunications and promotes the connection of students and teachers at remote sites. This is to provide educational programs, instructions, or information originating in one area, whether rural or not, to students and teachers who are located in rural areas, or connect teachers and students located in one rural area with teachers and students that are located in different rural areas. The idea, of course, is to overcome the effect of remoteness or rurality and to bring teaching and instructions from one end site or hub site to rural end user sites. Telemedicine. Telemedicine is a synchronous telecommunications link to an end user from medical professionals at separate sites in order to exchange healthcare information for the purpose of providing improved healthcare services to residents of rural areas. Telemedicine shows benefit to rural residents either by reduced travel or improved access to service. The idea here, synchronous telecommunication is critical in both the distance learning and telemedicine. The idea is to provide real-time interaction between a teacher and student, or real-time interaction between a doctor and patient. This is to be as close to being in person-to-person contact as possible. Here's a few statistics on the DLT program. In the 2018, we had $29 million available, and then we had $10 million additional available for opioid funding. This year, we are doing a special DLT project targeted at opioid funding specifically. There is a separate application guide, a separate funding opportunity announcement, and a separate webinar posted on our website if you are interested in that. They opened at the same time, but the opioid funding closes April 15th, and the traditional DLT closes May 15th. In 2019, the traditional DLT, which is one we're on now, the funding amount has not been listed. Typically, it's somewhere around between, say, 27 and 30 million. We do have 10 million that's been earmarked for the opioid DLT funding, which I mentioned earlier. Grants, specific needs, you have to have a 15% match. The minimum grant amount is $50,000, maximum $500,000. Only grants are available, no loans or combo loan grant. In 2018, we had 224 applications received, 132 applications approved of 40.8 million. You have the statistics here to break out between distance learning and telemedicine. And then, as you can see, we had distance learning in 32 states, telemedicine was in 39 states. Overall, 45 states and territories were represented. STEM and opioid special consideration, we had 63 STEM, projects, 51 opioid projects, and 18 that didn't request special considerations but did receive funding. For FY19, the full funding opportunity announcement was released February 14th. As I mentioned, opioid will close April 15th and traditional will close May 15th. Changes to the application guide for traditional DLT is primarily Section J. Applicants must provide acceptable evidence of legal existence along with a SAM.gov printout. This is specified under Section J of the application guide, and we tried to beef this up a little bit so it's clearer to us on the legal status of the applicant so that we can determine the legal status and verify it. There is an environmental requirements if you are requesting broadband facilities. Last year we did allow broadband facilities to be part of the grant funding. It's limited to 20% of your grant amount, and there are specific criteria if you plan to use any of your funds for broadband facilities. It's very specific. Be sure you read those clearly. And we do have a contact here listed on this slide if you have any questions regarding the environmental requirements for your broadband facilities. Applicant eligibility. The following entity types are eligible: incorporated organizations, Indian tribe or tribal organization, state or local unit of government, a consortium as defined in 1734.3, or other legal entity including private corporations organized for profit or not for profit. A consortium, every year we do have consortiums that apply. The consortium can fit into several categories. A consortium is a combination or group of entities formed to undertake the purpose for which the distance learning and telemedicine financial assistance is provided. If the applicant is an existing established consortium with legal ability to contract with the federal government, that organization can apply in the name of the formal consortium. These are the most straightforward. If the applicant is an informal consortium, which by itself lacks the legal capacity to contract, the consortium must have a physical agent from the consortium apply on its behalf. If awarded, one of two things will happen. You will be required to assign a physical agent from the consortium that may assume the sole responsibility and contract with RUS with all awardee responsibilities. They become the lead in the consortium group. Or each individual entity must contract with RUS on its own behalf, confirm legal existence and authority, and each entity of the informal consortium must sign all documents. This is a little more complex because everybody must sign, everybody must be responsible for the implementation of the grant. Categories of eligible purposes: acquiring by lease or purchase eligible equipment. If lease, the cost of the lease during the 3-year period of the grant is eligible. Constructing broadband facilities to serve DLT purposes, and this may not exceed 20% of the grant amount, and the applicant must own the facilities. You cannot turn them over to your local ISP when you're done. Acquiring instructional programming as a capital asset, including the purchase or lease of instructional programming already on the market. So this is instructional programming that you buy from a third party. You cannot have a member of your staff write or develop instructional programming because it would not be eligible. Providing technical assistance for the use of eligible equipment. This cost of this category may not exceed 10% of the grant amount. Ineligible purposes: to pay for medical educational equipment not having telemedicine or distance learning as its essential function, to pay for electronic medical records, medical equipment not used primarily for telemedicine, which is primarily used means 50% or more. We cannot pay for salary or administrative expenses, including recurring broadband connection fees. So we cannot pay for your monthly internet fee, application preparation cost, the purchase of land, buildings, building construction, site development, or destruction or alteration of buildings. Examples of eligible equipment: computer hardware and software, computer network components, data terminal equipment, inside wiring, audio and video equipment, telecommunications terminal equipment, interactive audio and video, broadband facilities if owned by the applicant. The application must demonstrate that the predominant purpose, which is 50% or more, of every line item of the grant and match budget meets the DLT definition of distance learning and telemedicine. All equipment must be new and non-depreciated. Matching contributions. The grant applicant's minimum matching contribution must equal 15% of the grant amount requested and be used for eligible purposes. There's a special matching provisions for American Samoa, Guam, Virgin Islands, or the Northern Mariana Islands for eligible purposes. This is detailed in the application guide. And matching contributions cannot include any financial assistance from federal sources unless there's a federal statutory exception. This means you cannot use other federal grants as match unless the other federal grant specifically has in its statute that that grant is allowed to be used for DLT matching purposes. Matching funds can either be cash or equipment used for the project or may be in-kind contributions from a third party. Matching funds must be for the purpose that would be otherwise eligible for grant funding. So it has to meet the same criteria of eligibility. That is, no salaries, administrative expenses, or other items prohibited from grant funding can be used for match. The value of in-kind contributions must be supported. Vendor discounts or supplied equipment is not an eligible in-kind contribution. Only new equipment may be used in the DLT project. Donations or use of partially or fully depreciated equipment is not allowable. So in the scoring criteria, we start with the objective criteria. Start with the reality. The minimum score threshold for the application to be considered must be 20 points. This category is based on census data, which we'll address a little later. And this is covered in detail in the application guide. You can go up to 40 points. Economic need, or SAPE, which stands for Small Area Income and Poverty Estimates, is economic need measured by the latest county SAPE poverty percentage, all ages data found at the U.S. Census SAPE data. There is a link in the application guide, and this is explained. You will go to the table, determine your SAPE data for your county, and it will go into your economic need worksheet and to determine your SAPE criteria and your SAPE points. Hub end users and end user sites located within geographic areas for which no SAPE data exists will be determined to have an average poverty percentage of 30%. This applies to some of the Pacific Islands like Guam, Northern Federated States of Micronesia, areas like that, which does not have any SAPE census data. Special considerations, you can receive 10 points 10 additional points will be awarded for projects with STEM education purposes or opioid treatment or opioid treatment educational purposes. So you can receive 10 points for a project that primary purpose is opioid treatment. And this is different than the opioid funded distance learning and telemedicine funding opportunity that we have going simultaneously to this traditional DLT. Special consideration purposes must be fully defined in the executive summary and the needs and benefits section. So you need to elaborate in those two areas. Please use the special consideration worksheet to identify a category of special consideration being requested. You can't request both. You can request STEM or opioid, so you can only get 10 points. You can't get 20 points by saying you're going to specialize in STEM and opioid, so you can only get 10 points. STEM. For the purposes of the DLT program, STEM is defined as education in the various science, technology, engineering, and mathematics disciplines. STEM encompasses a wide range of academic or technical subjects, including the physical science, life science, natural science, information technology, engineering, and mathematics education. STEM includes healthcare programs that train students for careers in the medical or scientific research fields. STEM includes career technical education and apprenticeships in any of the STEM fields, which can be considered applied STEM. So we have a pretty wide definition for the special consideration. For special consideration STEM, for STEM eligible purposes include classes offering STEM curriculum, training in the STEM fields, including apprenticeships, laboratory, or other equipment that contributes to the live interactive STEM curriculum. Special consideration for opioid treatment. For the purpose of DLT program, opioid treatment is defined as interactive communication between medical or educational professionals and opioid users or their families, other treatment professionals, or those who interact with opioid users. So again, a pretty wide definition for special consideration. Special consideration for opioid treatment, counseling of opioid users, treatment of opioid dependent persons, training of medical professionals, counselors, or first responders in the interaction with opioid users, education programs addressing opioid abuse. So then we get to the subjective criteria, need for services and project benefits. This criterion compares the specific needs for the technology in the proposed service territory and how the proposed project will address those needs and benefit the residents of the affected area, up to 30 points. Now the needs and benefits is well defined in the application guide and gives you areas to address when you are developing your needs and benefits section. Completing the grant application, these are the sections you will need to complete. The standard form 424 with site worksheet, the executive summary of the project, scoring criteria, matching requirements, scope of work, financial information and sustainability, statement of experience, telecommunications systems plan, or TSP as we call it, compliance with other federal statutes with checklists, and we will cover that in a bit, evidence of legal authority, environmental impact and historic preservation, and consultation with your state USDA state director. The DLT application checklist is available on the DLT website and should be inserted under section 1, signed by the authorized representative. So the DLT application checklist is a list. You just follow it right through and check off. Be sure you got everything included in your package. So it is very specific to the application, and if you submit everything that's on the checklist, you will have a completed application. Now, in Section I, under the compliance with other federal statutes and regulations, you do have to submit or sign a checklist for each of these 10 compliances. Some of these you will have to submit specific forms. Some of these you simply comply with by signing the application checklist, and some of them just require you to check a box, if you will, and submit the form. At the bottom, we've tried to explain the checklist. By signing the checklist, you are certifying you understand. By submitting the application, you have enclosed each of the following required documents: I-1, I-2, I-4, and I-9, but I-9 is only required for corporate entities. By signing the certification, you are agreeing to the language in Schedules I-3, I-5, I-6, I-7, I-8, and I-10. As shown on the application guide. To the extent the certification requires a question to be answered, please address your answer in a narrative attachment to the checklist. I-5 and I-6 have questions to be answered. So this can be a little confusing. If you have any questions, give us a call or give your local GFR a call, and we can help you decipher it. Please be sure to remember that to sign, print your name and title, sign it and date it, and submit it with your application. Very important. The overview of worksheets. You will need to submit your site worksheet, your rurality worksheet, your economic need worksheet, matching worksheet, special consideration worksheet, and budget worksheet. Again, all these worksheets are provided on the website, and instructions are included in the application guide. Site worksheet is where you begin. You'll fill out the site worksheet, site number, name, whether it's a hub end user or end user, street address, town, county, state, and congressional district. Very important that you fill out the site worksheet complete. If you use the site worksheets from the website, it will pre-populate your rurality and SAPE worksheets so that they will stay in the same order as you have them on your site worksheet. Rurality worksheet. Again, this is how this is explained in section C1 of the application guide. You will get your census data from the 2010 census. It's a pretty clear explanation in the appendix of the application guide on how to get that, and you will use that information to determine your rurality score. These are the point spread for the different ruralities. 5,000 or less is 40, 5 to 10,000 is 30, 10 to 20 is 20 points, and over 20 is 0. Again, you must have a minimum of 20 points to be eligible. Economic need or SAPE worksheet. There's clear explanation in the application guide. You will be directed to a website and a table that will give you your SAPE poverty percentage for your county. You will fill this out, this economic need worksheet, and determine your SAPE score. Again, it's pretty straightforward, and you will submit the worksheet with your application. Matching worksheet. Again, you will need to, if you have several people who are providing match, you'll have to list them here in the dollar amount. There is specifics on the matching worksheets. You will need to read section D of the application guide to be sure you understand it. It must be, you must submit a letter supporting your match. It must be signed by a person capable of obligating the match. Be sure to list specific dollar amount. Stay away, do not use percentages. Letters without stated cash amount cannot be credited as cash match. So it's very specific. State the dollar amount and have somebody of authority sign the letter. If your proposed match is in kind, state the actual dollar amount and give a complete description. You must support the value of the in-kind match. And proposed matches must be consistent on the SF-424, the budget, and the matching worksheet. Special considerations, please specify if you're requesting STEM or opioid. And please note that the project's primary purpose must be for STEM or opioid. It can't be an incidental purpose or a minor part of the application. It should be the primary purpose of the application. Budget worksheet. When you do the budget worksheet, please list your budget by hub and end user sites. In other words, don't group all the equipment together like if you got one hub and 5 end user sites, don't say 6 pieces of this equipment and 6 pieces of this equipment. Start by listing the hub and list the equipment that's going into the hub. Then list site 1 and the equipment that's going into site 1, site 2 and the equipment going into site 2, etc. You'll need a D&B number. Most of you probably already have one. If you don't have one, you can connect on this link to obtain one. So I would suggest you do that very early on. Don't wait till the last minute because you're going to need that for your 424 form. SAM.gov, you're going to need a SAM.gov number. You're required to have the SAM.gov number prior to submitting your application, and it should remain active the entire grant period. There is a link to how to apply, and you give yourself 10 days to get your registration active. To CFR 200 is the overall Code of Federal Regulations that is the overarching regulation over our grants. In particular, we put this part of the CFR 200 on our slides because it's very important. So 2 CFR 200-319 says that contractors that develop or draft specifications, requirements, statements of work, or invitations for bids or requests for proposals must be excluded from competing for such procurements. So in layman's terms, this means that you cannot have a vendor write your application for you. A vendor or a contractor, they can't write your application. They can't pay someone to write your application, and they can't even have somebody affiliated with them write your application, even if they don't pay them free of charge. So there can't be any link or any association between the person who writes the application and the vendor or contractor. If so, that particular vendor is excluded from bidding on the equipment or providing any equipment for this particular grant. Application submission, you can do it via grants.gov, which the majority of our grants come in that way. Please note that the SF-424 is on grants.gov. You will fill it out. You will have to fill out all the sections of your application offline, and once you get them complete, you can convert them to a PDF or a Word document. Doesn't really matter. And then you will have to upload them on the box 15 of your SF-424. If you have no questions, please reach out to us to let us help you with that. If you send in a paper copy, you have to send in 2 copies. One must have original signatures, and we ask that you submit a USB flash drive of your completed application or your complete application on the flash drive. Application submitted via paper with flash drive must be submitted to this address. This address is also in the application guide. This is the link to our website where you will find a wealth of information, the worksheets, additional forms that you may need, as well as this webinar and, of course, the application guides. Technical assistance, you can locate your local GFR, and this is the link where you can find the GFR for your area, or you can certainly reach out to us on the DLT email address or give us a phone call, and I'll list the number here in a minute, and we can give you a hand. Here it is, the email address, dl2info@wdc.usda.gov, and we certainly man this email address, and we will try to get answers back to you as quickly as possible, typically within a 24-hour period. And here's the phone number if you want to reach out to us to talk to someone in person. And that concludes this webinar. Thank you all for attending, and everyone have a good day.